The other part of the building upstairs is a birthing center, and there are 4 birthing rooms where the mom will come in, stay in that room before labor, deliver, and have the baby. We can have, our turnover probably will be every 24 hours. We're going to start with low-risk pregnancies. These are only going to be births of mothers that we have done the prenatal care on and that have attended our prenatal classes. So moms that come to us in the last month and say, I want to birth here, I'm sorry, we're not going to be available to those moms. Number one, because we don't have the facility yet to do C-sections and higher risk pregnancies. And number two, because the focus of this whole program is education. And if we can't educate the moms before they deliver, we're sure not going to get them after they deliver. So, and it encourages our prenatal classes. The classes have doubled in size in the last year because of the anticipation of being able to birth here. Our future plans, we're already looking to build our second building where we'll have a same-day surgery suite where people can come in, and it'll provide a great place for the surgeons on the island, the orthopedic surgeon, the general surgeon, the OB/GYN surgeon, that they'll be able to work in an atmosphere where it'll be clean and nice and doctor friendly, so that we have everything that they need to work and to do surgeries in an area where they're safe. Along with that, we'll have visiting doctors come down and work alongside, both to teach the doctors that come down how surgeries are done here. They may be done different. They're not done with any less care and any less concern than any surgery in the U.S. I would match any of our doctors here on the island with U.S. surgeons. The surgeons here don't have the materials, but boy, they have the caring and the knowledge.
Yeah, that's what I hear. I hear just wonderful things about Indira, wonderful surgeon, a lot of good people here.
And Dr. Dominguez is an excellent orthopedic surgeon. Dr. Amanda Everett is our new OB/GYN. She's been on the island a year, and these are all wonderful, wonderful doctors. I tell people when they come to the clinic that Dr. Raymond Charrington is the best doctor I've ever worked with in the world. I match him to any. And I'm old, so I've worked with a lot of doctors, and to me that says a lot. Dr. Rafael Solis, our pediatrician, excellent, excellent pediatrician. I've asked them on numerous occasions why they do things the way they do, and they've always had absolutely excellent answers into, why they're doing things the way they do. And just all right on, and they try to stay up on the latest medication and the latest practices. So I'm really ecstatic about getting this open so that we can help them help their own people.
Well, it's obvious how much work you've done, how much you've given of your time for the island, for the Bay Islands, and all the people that visit here. People come down here, they fall off of motorcycles. I mean, like you said, this is the center for people coming, who have problems.
I think one of the things I tell people this is a clinic for the poor and the underserved. And unfortunately, if you're on Roatan, you're underserved. We need a new hospital. And hopefully, this administration will make that a reality. But when a gringo or a visitor or someone off the cruise ship gets hurt and they bring them here, I think their comfort in knowing that there are other English-speaking people around. Not that the other hospitals do not have English-speaking people, but it's just, I feel if I were in Guatemala and I got hurt and there was an American working in a clinic, that I just feel comfortable. That doesn't mean that this is any better than the other places. It's just a comfort level. And, you know, people hear about us and they pass it on that this is a good place. The beauty of having those Americans or Canadians or visitors or come here, tourists, is that they see what we're doing and hopefully they'll contribute or they'll go back and tell others. We're on a big campaign right now to be able to get funding for this floor. It will cost us about $30,000 a month to keep this open, a month. And so what we're asking is for people to go on our website, which is clinicaesperanza.com, and hit the Donate Now button and donate $50 a month, $100 a month. And then it's cheap insurance, especially if you have children on the island.
So you kind of answered my next and last question to you is, let's ask, how else can people help you other than donating? How else can people help? What else do you need?
Prayers. I need lots of prayers. It's just amazing that things happen the way they do because, you know, we're now ready to build the second building. I don't have the funding to do this yet, to open this. We're pretty much there. We're pretty much ready to go. We have 6 months funding. I'm hoping that people will step forward and say, hey, you know, I'll fund your doctor, or I'll fund a half a doctor. It's $2,000 a month to fund a doctor. And once we're open 24/7, we're going to need 3 more doctors. We're going to need 6 nurses up here at minimum. So, you know, a nurse is $500 a month. A doctor is $2,000 a month. You know, you've got an extra $500 a month sitting around, or $50. Do 1/10 of her, you know, and because if I get 50 people doing that, this will be paid for. There'll be no worry, and it'll be sustained. My biggest fear is when I go that the doors will close because of lack of funding. So what we're trying to do is get the funding in order that we can get an endowment going so that this will continue on long after any of us are here.
How can people get in touch with you other than the website? Is there ways that people can contact you if they want to help?
If you want to help, the best way to get a hold of me is peggystranges@yahoo.com. It's, you know, I can give you my phone number, but if I do, I may not be able to answer that because I'm busy doing things all day long, and I'm trying to look for money to keep this open. My job now in the clinic from being a nurse has been to procure financing so that we can keep this going and keep the wonderful doctors that we have here working to help the people of Honduras.
God bless you, Peggy. He already has. God blesses this island by your presence. And I'm so happy to have known you and Dr. Charrington for so long. It's just been, you're one of my prized friendships, even though we don't see each other quite so much anymore. You're always in my heart and you're always in my mind. And God bless you and thank you for what you've done for the island.
Thank you, Bruce. And I really appreciate what you've done to get the word out about what we're doing here. And everybody on the island, I am so appreciative of all the help. This is not me. This is the work of thousands of people and just what can be done if we all cooperate and work together.
Thank you.